Hello and welcome. My name's Michelle Moser, and I'm the clinical liaison for functional medicine for Revelation Pharma. Thank you for joining me today. I hope you enjoyed this presentation. Today, we're going to talk a little bit about women's health and libido, some of the medications associated with that, a lot of the hormones that are associated with that. And this webinar is specifically for informational purposes only. I do have a lot of information to share, but also quite a few other pieces that are associated with compounded medications that are not necessarily approved or evaluated by the FDA. Specifically, what hormones play in with libido and overall health, immunity, that sort of thing? What's oxytocin and how's that got anything to do with this? But certainly, with as much stress that's going on, that plays a large role. So we're going to talk a little bit about that. But the bottom line is most of this information is being provided so that providers can make a greater impact on the overall health of the patients that they're seeing. Hormonal imbalances can start as early as our 20s, and that is a scientific fact. We are seeing more issues with women with premenstrual dysphoria. We're seeing some issues associated with infertility a little bit later in life, a wide variety of PCOS, as well as we approach our 30s and 40s, perimenopause or premenopausal issues start to crop up. Birth control pills are commonly prescribed to help regulate those irregular cycles, but also as just kind of a quick fix or a thought that it's a quick fix. But those synthetic hormones are not necessarily going to play the same role as bioidentical hormones. And really, hormones really aren't that complicated. They are very easy to track and follow as long as we're doing the appropriate testing. This is, after all, basic human physiology. Often we walk into a room and we just don't know why we're there, right? But it comes down to we just don't want to lose it. But what is it? Well, we're very concentrated on, are we losing our memory? Short-term, long-term, but just losing our memory. We also find that sometimes aches and pains get in the way of our ability to move and even just being slightly out of shape. We also are more concerned about our eyesight these days. We're seeing that we have more wearing glasses earlier. There's some lens corrective procedures that can be done, but we just want to be able to see things bright and clear and understand why we walked into that room. And the bottom line is nobody wants to lose hope. And that's where I feel that medical providers can have the greatest impact. And of course, nobody wants to lose their libido either. Of course, the symptoms can be rather confusing. Sometimes we associate some symptoms as being estrogen deficiencies, when really it could be a deficiency of other hormones or maybe an excess of corticosteroids, such as cortisol and some of those other metabolites. And that can play just as large of an impact on hormone dysregulation, as well as thyroid issues, as well as what is going on in our gut. Because sometimes when we're really stressed or even just mildly stressed, we tend to head toward those foods that bring us a little more comfort. And sometimes those simple carbohydrates are not necessarily really full of nutrients that are going to help bail us out of this situation. But there's a lot to cover, so let's get going. It all starts with cholesterol. All hormones start as cholesterol. And what's interesting is that the thyroid has a very large impact on how much cholesterol is made at any given time. So if we have elevated cortisol, is it because the thyroid isn't working as well? Or is it perhaps cortisol is elevated and the body thinks we just need to make more? Perhaps there's even a hormone dysregulation that the body is perceiving that we need to start with the basic building blocks to ensure we can cover all of that. So that's why I really like this chart, because it shows where things go and how things can play in amongst each other. And really, it's about understanding exactly what metabolites are available and which are not. And then also what nutrients actually trigger these pathways and are essential for the metabolization of one hormone to the other. And of course, if we know how the metabolization pathways work, a lot of times we can reverse them or slow them down so that we can shunt the progress of how hormones are utilized in the body toward a different direction and perhaps alleviate symptoms. Estrogens are really important, and I think we put a very long emphasis on estrogens. Usually when we see a wide variety of symptoms, that's the first place that we think of, but perhaps it's not just the only hormone that we need to think about. What we do need to keep in mind is that estrogens have a very pivotal role, primary role in over 400 different functions in the body. Low estrogen means that she's not going to be able to multitask and think very well. Her words aren't going to come as easy as they normally do. And why is that? Well, the brain is bathed in estrogen. But estrogen is very important in the role of building and maintaining good immunity, good muscle mass, being able to regulate body temperature, improve sleep, as well as metabolic rate. It helps to reduce the risk of cataracts. So if estrogen is maintained at a physiologic level, we see better eyesight, for example. But we also see that the skin and the collagen in the skin tends to maintain its turgor. We see better regulation of blood pressure. We also see changes in low density lipoproteins and cholesterol. And we can a lot of times be able to improve our cognitive thinking. Now, this doesn't mean that we should all go out there and just jump into a vat of estrogen. That's not the point. The point is to make sure that we are staying within physiologic range. Because if we have too much estrogen, we've been playing around with plastics, or we assume we need a certain level of estrogen replacement, and maybe it's not coupled with a progesterone, then perhaps we can fall into an estrogen excess. And estrogen can actually suppress the functioning of thyroid. It can also lead to fatigue, uterine fibroids, because estrogen is a growth molecule. It can also increase headaches, as well as increases the risks of autoimmune diseases. Autoimmune diseases tend to be much more prevalent in women. And of course, we're always going back to that cancer risk. So if we have too much estrogen, do we have an elevated risk of any kinds of cancers, whether they're in the uterus or in the ovaries or in the breast or anywhere else? And truly, that is a factor that we need to keep very close attention to. But perhaps there's other reasons for that as well. Of course, if we're taking too much estrogen in, or we're not eliminating estrogens appropriately, so whether it's through the fecal material or even just earlier metabolization through the liver. Perhaps we're not exercising as much, or we have a diet low in grains and fiber, especially fiber. There is also a wide variety of elemental and environmental estrogens, and that can happen in plastics, for example. The reason why I included this slide is because with the metabolic pathways, we can see where we can go from the good to the not so good to the really bad. And we can affect these and actually change these through supplement usage, whether it is with specific amino acids or very specific herbal products. We can make an impact and perhaps even stop or slow down those pathways that would not necessarily allow for detoxification. Because here again, xenoestrogens, xenobiotics, a wide variety of pollutants, tends to be a very large factor to consider, especially with the increase in diagnoses of polycystic ovary disease, as well as the American diet tends to be very sad. The standard American diet is not very full of whole foods, foods that are found in nature, and lots of vegetables. So when you increase all of these small factors, they do compound. And what happens is that the solution to pollution is dilution, which maybe the patient's coming in saying that all of a sudden she's gained a lot of weight. Well, perhaps it's been a slow accumulation due to pollutants and xenobiotics and xenoestrogens over time that is causing her to gain weight, because the body wants to decrease the polluted pool by increasing its volume. But again, there's a lot that we can do to make an impact and change things. We can learn how to stop smoking. We can learn how to exercise effectively. We can change insulin resistance and insulin sensitivity to the cells. We can also lower our stress. We can do that by first identifying exactly what is elevated at what time of the day and using different herbal products to help sequester that and lower those. They lower the production of cortisol, but we can also then be mindful and present and find other avenues such as meditation and prayer to decrease our stressor factors. And all of this does a really nice job of helping us to come into more of a hormonal balance as well. Cardiovascular disease and gastrointestinal dysfunction play a pivotal role. I can't emphasize this enough. And to really identify what is going on in the gut, and that actually starts here in the mouth. And we do know that science has shown us that if the mouth is not healthy, that could very easily lead to cardiovascular disease. But we can't forget that increased cortisol levels, increased aldosterone levels, increased catecholamines, because we're wired and we're stressed, can increase blood pressure. It could also then change what is actually happening in the gut, which can become a very vicious cycle that deteriorates health over time. And I hear this so often that women get to a point where they feel like their body is divorcing itself from the rest of its being. Women are finding a hard time connecting with other people, but they're also finding it hard to understand what is going on. They literally say, I think I'm losing my mind. And they literally are fine one year and not so fine the next year. They're concerned that they are getting Alzheimer's disease or dementia. That is very key. We just don't want to go there. That's not one of the things that we want to have diagnosed at a later time. But we also don't want to lose our eyesight, and cataracts are one of those things that can easily be identified early through examination, but we can use bilberry, and we can also balance our estrogens with the other hormones and perhaps slow down the development of cataracts or even reverse those. Estrogen deficiency has actually been suggested to increase aging. Of course, we see wrinkles, and a lot of anti-aging creams actually have mild hormone in them. And it's not just about the face, right? It's about the neck, the décolleté, and we want to make sure that our skin is not thin and it's not easily snagged when we're going around a corner. We want to make sure that our skin is firm and has good texture, that we have less formation of cellulite, and when we get older, we don't necessarily want our skin to be saggy and wrinkly. Well, there's a way to help balance estrogen with the other hormones, decreasing our cortisol as well as those metabolites, to then make sure that we're on a very good, healthy pathway. And it's all about testing. It's also how we're actually delivering those hormones through the skin to enhance the aging process, not accelerate it, but enhance it and slow it down so that we can find that inner beauty and that external beauty at the same time. We've known for many years now that estrogen replacement is very key in maintaining good overall health. It is a very important element in maintaining good immunity, and perhaps even just taking a look at, in this research specifically, that women who have hysterectomy early perhaps could have died prematurely because they didn't use estrogen. And that doesn't mean that just because you have a hysterectomy that all of a sudden hormone balance is corrected. That's truly not the case. Just because you remove the uterus doesn't mean the hormone balance has changed whatsoever. That imbalance is still there. We still need to look at the hormones and see where have things gotten off kilter and exactly what to replace. Because a lot of times it's low progesterone. Science has shown us over the years that progesterone is usually one of the first hormones that tends to decrease its production in the ovaries. So the progesterone is made in the corpus luteum. So you have the luteinizing hormone, the follicle stimulating hormone, and a lot of times that ovum is selected even 90 days prior to its maturation. But when it is mature, then it will move to the outer core of the ovary. It will break open the corpus luteum, or the rind that's left behind is where the progesterone is made. The egg is then released from the ovary, follows the fallopian tubes. And if it's fertilized, then we usually see a pregnancy. If it's not fertilized, then we see the menses actually start. So we start the bleeding cycle. However, if progesterone is one of the first hormones to drop off, then a lot of times we see symptoms of estrogen excess, even when estrogen is completely normal. And that, again, is why it's very important to test, because those symptoms can actually fall in both categories of estrogen excess and progesterone deficiency. Progesterone is very, very important. It works as a diuretic. It's an anti-inflammatory. It helps maintain bladder control, helps to build bone along with the other hormones, and it helps to work specifically with GABA so that she feels much calmer and much more secure, as well as happier. And it balances estrogen. It helps to decrease irritability, anxiety, and mood swings. We also see that it helps to eliminate fats. It helps to promote Th2 immunity. It lowers low density lipoproteins, and it actually is included and mandatory in the conversion of estrone to its inactive sulfated form of estrone sulfate. Not enough progesterone, that doesn't happen. Then you have more estrone, and estrone is one of the hormones, even though it is weaker than estradiol, it is not necessarily always a good girl. And a lot of times we see estrone associated with the production of cancers. And a lot of times those cancers can actually make their own estrone. So it's one of those hormones that we really need to keep under control. But it also, progesterone is very important in the formation of myelin sheaths. So we're seeing more and more issues of neuron imbalance. So we're seeing some nerve conductivity issues, even autoimmune diseases such as multiple sclerosis, and progesterone has a very large impact in that. Now, progesterone is not progestins. So in fact, I was listening to another webinar on infertility and the use of birth control pills to help control those kind of wonky cycles that happen around perimenopause. And the provider was talking about birth control pills of being estrogens and progesterone. And that's not true. Progesterone is natural to the human body, whereas a progestin is a synthetic. And they have very different functions in the body. They are not metabolized the same way through the liver. And those active metabolites do have other characteristics that natural progesterone does not have. Natural progesterone, as I put together in this previous slide, it enhances all of these products in all of these processes, where natural progesterone does do that, but synthetic progestins don't necessarily do that. And all the way back to the early 2000s, we did see that when estrogens combined with progestin perhaps led to an increased risk of breast cancer. And that's because we do see a higher inflammatory rate with the use of progestins. Side effects of progestins a lot of times are opposite of the benefits of natural progesterone. So side effects of natural progestins, we do see an increase in inflammation. We see irritability, depression, where we actually saw the reverse of that with natural progesterone. It does interfere with the body's production of its own progesterone through a negative feedback loop, and it does not help balance estrogen connectivity. So those receptors are not necessarily maintained at the same rate. It does stay in the body longer because it does like to hang out in the fat, and it can actually cause spasms of the coronary arteries, whereas progesterone actually relaxes the coronary arteries. So when we're talking about libido specifically, if we can balance estrogen and progesterone, we can't forget about testosterone because it too is implicated in sexual interest. Although it's not necessarily the only hormone, but it does play a very large, important role. Testosterone is very important in maintaining memory. It also helps with skin turgor and connectivity. So the fibrin and the collagen kind of is much more firm and stays together. It helps to burn fat. So if we have good testosterone levels and we are not converting necessarily to dihydrotestosterone, we do see better bone strength, and we also see better skin and hair control as well. Now, if we don't have enough enough testosterone, we do see that the memory is not as sharp, that we see low self-esteem, weight gain, we see thinning skin, we can see thinning and dry hair, as well as the skin just changes altogether. And one thing that I really wanted to note here is that we also see droopy eyelids. So we see eyelids that actually come down and sometimes rest on the top of the eyelashes. And we can use topical testosterone, for example, on a Q-tip and apply it to the eyelid, and that will firm up that second eyelid, so to speak, and help to decrease that look as well. So often testosterone decreases as we age, but certainly decreases again through menopause. Childbirth can trigger that as well as other chemical imbalances or hormonal imbalances such as endometriosis. Sometimes physical trauma. We also see a change in hormone balance altogether, where we can see a lower amount of testosterone with the use of synthetic hormones, but also when we are using a wide variety of other medications. There's medications used for blood pressure and pain, for example, that can actually lower the amount of hormone produced in our body. Vaginal dryness is really important to overall health, especially for women's well-being. And it's not just vaginal dryness. It literally can make or break your overall day. But certainly if we want to have a good, healthy, sturdy libido and be sexually active, vaginal dryness isn't necessarily our friend, but there's so much that we can do to help with that. There are some hormones that we can use, not necessarily just estrogen, but we can also combine progesterone, and we can't forget DHEA. All of those hormones play a very important role in maintaining the vaginal wall so that it is nice and firm, and also that those tissues are elastic and plump. Estriol, which is the third metabolite of the estrogen cascade, is one of the weakest estrogens in the body, but it does have an overall greater affinity for vaginal tissues than some of the other estrogens, and it's not necessarily implicated in breast cancer. And DHEA, which is often metabolized to testosterone and onto estrogens, can again be used. And DHEA, when we put it into a vaginal cream, does become a prescription product. But you can take oral DHEA or even 7-keto DHEA to help not only provide a better sense of well-being, but also to help kind of from the inside out build the vaginal tissues as well. Now, oxytocin, wow, what an amazing hormone. So this is a natural hormone that is produced in the body, in the brain, and it can help plump those tissues as well, especially when it's put into a gel base. And sodium hyaluronate, we cannot forget that. So it's commercially available in some oral forms. It's also available in a topical product, as well as vitamin E. So those products put together can really help rejuvenate those tissues. Using Personal lubricants for everyday use, but also during intimacy is really, really important. And the type that is used is important as well, because we don't necessarily want to use a product that is going to kind of clog up the urethra or even allow for bacterium to continue to grow. So using silicone based can be very helpful. There's a wide variety of products out there, like Good Love, there's Slippery Stuff, there's several other personal lubricants, but then there's also Uber Lube, which is more of an oily base. And also it has some great properties associated with decreasing bacterial count. So it just is about personal preference, but a good personal lubricant is very important for everyday life. Oh boy. Overall women's health, boy, we do focus a lot on mood swings, hot flashes, and night sweats, mainly because hot flashes and night sweats are probably the two elements, basically one in the day and one in the night, that just take away our feeling of being sexy. I think that hot sweats, night sweats, flashes, they come at the worst times, right? And so you might be a little bit stressed out and all of a sudden start turning red and then even form some perspiration on your face or even just start dripping. And all of that can due to be associated with low functioning thyroid, elevated cortisol, absolutely stress, but also a wide variety of vitamin deficiencies. Perhaps we're just not getting enough vitamins in our foods. Perhaps we need supplementation for that. Often women are told exactly what their menopausal years are going to be like, and they believe it, even if they don't want to. But there's a wide variety of resource out there that can help you identify what you can do about it early. You don't have to suffer through it all. You don't have to go through years and years and years of trial and error. There are ways to identify what is missing and replace exactly what's out there. Antidepressants a lot of times are prescribed and they work sometimes. Sometimes they actually cause more skin dryness. There are some side effects to a wide variety of them. And some of the antidepressants actually lower libido even more or lower your ability to have a full orgasm. And that isn't necessarily in the right productive pathway that we're looking for. We can always test hormones. Blood isn't necessarily the best way to test hormones, in my professional opinion. I think that there's a lot of ways that we can look at overall hormonal health, especially if we're wanting to know exactly how she's metabolizing those hormones so that we can reverse kind of the bad and the ugly pathways more toward the good pathways. And there's a variety of over-the-counter supplements, whether we're talking about the core four, right, which is a multivitamin, a B complex, a good omega, and a vitamin D. But let's not forget those herbal products or even natural amino acids that can help to decrease mood swings, help us to feel happier, help us to engage those hormones that are in our gut. Because serotonin, our happy hormone, about 90% of it's actually made in the gut, not necessarily in our brain, but yes, in our gut. So if our gut's not healthy, if we're not putting enough water in our bodies, enough nutrients in our bodies, we're going to probably suffer from that. We probably won't even see enough GABA produced further down the metabolic pathways of the gut. So L-theanine, very nice natural amino acid that helps us to be calm, and a lot of times will elevate our mood. And at this point, I really haven't seen an upper end of L-theanine on an upper dosage limit, but it's available in a 100 milligram capsule. And I think that people can use that throughout the day, of course, with medical advice to really help kind of even things out. Of course, there's other products as well, berberine, black cohosh. We can see the omegas being used on a regular basis. Magnesium, very, very important. And evening primrose oil is important as well. And again, it really depends on that individual that's in front of the provider and how to evaluate what's going on with her is going to give her hope and is going to give her avenue by which she can make choices for herself. So with guidance and with care, we can get her through these years. Absolutely. But we can't forget about what's happening with her diet. How much alcohol is she taking in? Is she actually dehydrated? And how much protein is she eating, let alone good fats? And by the way, how does thyroid play with all of this? Oh my gosh, it's a master metabolic gland, right? So it sits right here in the neck, right below our Adam's apple or voice box. It tends to be kind of a butterfly shape. The parathyroid sits on top of that. And low functioning thyroids tend to follow on the female side of the family tree. Of course, we also have to pay attention to what's happening in the gut because of autoimmune triggered thyroid disease is very prevalent and usually has a gut metabolization issue associated with that. Whether she's sensitive to gluten or she's going to be sensitive to dairy, all of that is play very key pivotal roles. And there's very specific testing that we can do. So the standard in the United States is primarily just looking at TSH, which to me is looking at one corner of that puzzle, and that is only going to give you a tiny bit of information. And it's not going to give you enough to really treat because there are many factors that can change TSH, not just levothyroxine, but really what's happening with T3, which is liothyronine, and that is the only form of active thyroid in the body. But if her stress is quite high, perhaps that cortisol is taking that active thyroid and actually changing the positions of those iodine molecules, causing it to turn into reverse T3, which is no longer active. So are we really evaluating everything that we can on that blood draw to fully understand exactly what's going on with thyroid? Because if her thyroid isn't playing well, she's not very happy. She's got a laundry list of symptoms. Hot flashes and night sweats are way up there, moods, headaches, a wide variety of other issues, as well as weight gain. So in this picture, this is a picture from the book Hypothyroidism Type 2 by Dr. Mark Starr. This picture was actually taken, I believe, in 1913. However, when you take a look at this beautiful woman, you could probably equate this picture to many, many, many other people that you come in contact with just walking down the street or sitting in a restaurant. You could look around and go, oh my gosh, she looks a lot like that person and that person and that person, because you'll notice that she's rather thick through the jawline. Mucin has collected here. She's rather thick through the neck and especially up above the collarbone. And her hands are kind of puffy. There's really not a lot of delineation between the fingers and on the back of the hand. And her hair tends to be kind of flat and not very shiny. And look at those eyelids. They are puffy. All around those eyes, they are puffy. She has second eyelids that are drooping down over the top of her eyes. So what can we do? Well, let's take a look at that full thyroid panel. Let's evaluate what's happening with those antibodies because we can use low-dose naltrexone to help reduce that antibody load and help her get on a better metabolic pathway using either synthetic levothyroxine liothyronine or even the desiccated porcine thyroid, such as Armour. Unfortunately, Nature Throid really isn't around anymore, but we can still compound with desiccated porcine thyroid. We can also evaluate through blood draws what's going on with her chromium, selenium, vitamin D, zinc, and of course, a full iron panel. Ferritin is key in understanding how the thyroid is really fully functioning. The stress. Who isn't stressed? I mean, my gosh, the last 3 years have been something else, haven't they? Well, stress will shut down her libido because the body isn't necessarily meant to reproduce when it's fully stressed out. Stress, that cortisol level. And is it just cortisol or is it a variety of those metabolites as well that can lead to insulin resistance? It can actually change her voice and she sounds kind of hoarse and groggy, but it can really rack your sleep. And why is that? So many women complain about, well, I wake up about 2, 3 o'clock in the morning and I'm just like, bing, my eyes are open and my head starts racing and I can't control my mind. And it's just time to get up and I just can't get back to sleep. Or they do get back to sleep and then the alarm goes off 30 minutes later. Well, why is that? Well, physiologically, cortisol is meant to be elevated to get us ready for the morning. However, if we have elevated cortisol levels throughout the day, that can have a very serious impact into changing that diurnal rhythm. It can, as cortisol goes up, our blood sugar goes up as well because it pulls sugars out of the blood cells, makes that instant energy available so that we can run away from whatever is chasing us. However, might not actually be utilizing all that extra blood glucose, and instead the cells become rather resistant to an elevated blood sugar level. And what happens? Well, the body tries to put it back into the cells. It doesn't go in. So then we pack weight around our middle because that's where it's usually released from. And guess what? The pancreas is kind of tired at this point. And so we're packing a lot of fatty material around our tummy, right around our rib cage and a little bit lower. And it also increases our cravings because as the sugars come out of the cells, producing energy available for us to run away, now our cells think we're starving and it wants extra carbohydrates to put all of that back. And as we know, elevated blood glucose levels can increase aches and pains. It can increase cholesterol. It can increase blood pressure, and it can really cause an inflammatory process throughout the whole body. And all of this, I'm sure, sounds very familiar because this is usually the laundry list of symptoms that women come in complaining about. And what can we do? Well, there's a lot of physiologic changes that we can do. Number one is recognize what is actually happening. As it's happening, we can help to stop, be mindful, be present, and help to breathe deeply. We can change the rhythm of our breath so that we can slow that down. That will decrease our blood pressure. That will decrease our stress level. We can drink water. We can use mild exercise like Tai Chi, yoga, Pilates. We can use gravity as resistance. We can find meditation. We can pray. We can close our eyes. And all of that is to be still. And even be barefoot walking in the grass can help to decrease our stress and cortisol levels. We can also test through simple salivary collection multiple times a day or even once or twice a day. And all of that will help us evaluate exactly when to use herbal products to help reduce that cortisol level. And if necessary, if we have been in that elevated cortisol stage for too long and the adrenal glands are just exhausted and now they're not producing enough cortisol, but yet we still have that same laundry list of symptoms, then we can actually put cortisol back into the body to help with that balance, because we don't want to gain any more weight. We don't want to deteriorate brain function. We don't want to have brittle bones at any point in our body or any time in our life. And we want to really shut down those cravings and even out our mood. And everybody wants to sleep a good 7-8 hours every night and have a lovely, healthy gut and be perfectly balanced with all of our micronutrients. All of this can be tested. All of this can be available very quickly and provide very nice, clear-cut information so that we can make a difference. Because usually one of her first complaints is, I just don't care if I ever have sex again. I love my partner. I don't want to change anything about my partner. I just don't care to be intimate. Well, Dr. Devaki Lindsay Berkson wrote this amazing book called Sexy Brain, and it is a very frank, upfront delineation of exactly how complex women are compared to very linear men, and really about how everything that happens during her day comes down to whether or not she feels attractive, sexy, even cares to engage in contact, let alone be intimate and have sex and be able to orgasm. And Dr. Berkson even goes into how to evaluate what is going on underneath. So is there underlying trauma? Is there underlying mental concern that is actually changing the body metabolically? There are ways to help with that as well. Because being sexually active, having great orgasms, being connected to another person really helps us to be very healthy, helps to maintain good immune system, and just healthier, happier bodies for as long as we possibly can be alive. Oxytocin is the key element in my professional opinion that can really help, and it's not talked about as much. But what I love about oxytocin is, it is a natural hormone. It's a hormone that mama releases a lot of as soon as that baby is born and put on her chest, that connectivity, that warm, wonderful sensation that comes over us to be able to fall in love with that child and connect with that child. That is oxytocin. Men produce a little bit of oxytocin. Women produce a lot more of oxytocin. During grief, during menopause, during maturation, we tend to slow down our production of oxytocin, but we can put it back. And we usually can compound that in a wonderful nasal spray. We can put it in a sublingual drop or even in a vaginal gel. Science have shown us that anywhere from 12 to 24 units used even 10 to 15 minutes prior to intimacy can bring on a better sense of connection with that person and have a better orgasm. Using that in a nasal spray tends to be very easy to do and easy to compound. So when we're dealing with menopause, so really everything that I've talked about up until this point applies to just about any age, but women, when they hit their perimenopausal, menopausal years, tend to really focus on what is going on with their body. And they tend to be, the kids are out of the house, they're full into their career, maybe even looking at retirement. And so now it's time to focus back on herself. Of course, hormones change as we age, but we can evaluate what's going on at any given time. It's really easy to do. Salivary testing is something that a patient actually does in the privacy of their own home. It's usually collected first thing in the morning. If she is menstruating, we have to time that just right in her cycle. But if we are dealing with a postmenopausal woman or a menopausal woman, usually she can determine whatever day of the week is going to be best for her schedule to start that collection. And if we collect even 2 or 3 other times during the day, then we can also evaluate what's happening with cortisol, because we could see a passive migration of both the hormones, the sex steroid hormones and cortisol through the salivary pool. And this just goes through that laundry list of symptoms that we're usually approached with that are signs and symptoms of menopause. So I wanted to go over a little bit about testing and what's available. So any provider can sign up for a lot of different types of testing to have that available to your patients. It is something that you can provide through the office. Sometimes that can be an income generator as well. But you can look at a lot of different things, and it doesn't have to be super expensive. So there are saliva labs out there. ZRT lab is one of them. Genova is another. And Great Smoky Mountains. And there's a lot of different labs that are out there. There are also labs that look at dry urine, and we can look at metabolites in dry urine. So we have Precision Labs that has Dutch testing. ZRT has urine testing. And we can also look at blood or serum or even blood spot. Now, there are certain types of testing that we can only look in specific mediums. So we're not necessarily going to find them in other mediums. So for example, thyroid testing. We can either pull a full serum or we can do a blood spot, but we're not necessarily going to see the thyroid molecules in urine or in saliva. They just don't show up there. Same thing with vitamin D. We're primarily only looking at blood. However, if we're looking at sex steroid hormones, we can see that in saliva and the metabolites in urine. In my professional opinion, I think it's a little bit harder to evaluate and understand dosing based on urine testing because it is metabolites. They are what's already been through the body. And so that just gives you the metabolic pieces that are left over, not necessarily helpful to identify what is actually sitting in the cells. We can look at serum for hormones as well. It is a little more difficult, mainly because sex steroid hormones are oils and the blood is water. And when we mix oil and water, we have to have carrier molecules like sex steroid hormone, or sorry, sex hormone binding globulin to carry those hormones to the target tissues. And the hormone levels can actually vary how much SHBG is wandering around. And we can also look at hair loss treatments. There's a way to test where in the hair development process is there some deficiencies so that we can put a lovely locks of hair back into someone's life. And that's just a simple cheek swab. And the cool thing about that is that's a one and done. You literally don't necessarily have to repeat that test any other time in the life cycle. We can look at genetics testing. 3x4 Genetics is a company that I'm aware of that you can look at 36 core elements and understand not only what's happening with organ health, but also other metabolic processes. So is there a genetic SNP if someone doesn't methylate appropriately, or is there a genetic SNP that someone is heterozygous for metabolization of certain drug classifications, that sort of thing. But it gives you a really good picture as to whether or not she should be running a marathon or using yoga as her exercise element throughout her day. So even caffeine metabolization or salt metabolization, and sometimes those elements, understanding that those small pieces of information can make a huge difference in identifying how to make corrections in her health pathways. And of course, what I did not actually include in here, alluded to, but didn't actually make it as a bullet point, is we can always look at micronutrient testing. So there's SpectraCell and there's Vibrant America. There's a wide variety of other tests that are out there too that can really identify, does she have enough B6? Does she have enough magnesium? Does she have enough iron, for example? And those blood labs can be rather inexpensive. So there's several in-house blood draw labs. You could also go online and use different blood companies to prepare the requisition and then take into a phlebotomist to have the blood drawn. It does not have to be exorbitantly priced. Whether or not she has insurance will determine exactly what she would like to do with all of those tests and make that available. But again, as medical providers, you can sign up to be providers for all of these different elements and really have a nice catalog of tests that are available so that she can find those answers to help her along her health journey so that she can find hope. Because a lot of times, by the time she finds one of us, functional medicine providers, she's gone through a lot of years trying to understand exactly what's going on. And it's hard because she may not have as much hope and she may not be very comfortable. And it's not uncommon that people in their 40s and 50s have a higher divorce rate than a lot of others age groups. And that's really unfortunate. It shouldn't necessarily be that way, but we can help provide ways to balance the body so that we can feel better about ourselves. This is just a picture of some of the ZRT test kits that are available. We can also look at exactly what's going on in the gut. And why is that important? Is because that's the foundation of our immune system. That's the foundation of our metabolic processes, as well as those elements that we need to eliminate. So as the liver metabolizes our foods and our medications, is the body actually eliminating appropriately? So people don't have to necessarily have horrible symptoms of IBS or small intestinal bowel or bacterial overgrowth or fungal overgrowth or even autoimmune diseases like Crohn's to use this test. Anybody can use this test. And what happens is that it is a fecal collection. So it's a stool collection. And the kit actually comes with all the necessary elements and tools to use to collect that on a one-time evaluation. Everything is sealed and it's whisked away, and results do take a few weeks to come back. But then you get this 20+ page color report that identifies the families and species of what is there, along with the comparison to what would be in a standard healthy American. So those keystone species, are they there or are they very low? And those a lot of times can be identifiers to understanding why there's insulin resistance, why is there more metabolic syndrome, why she's not happy, maybe she's not producing enough serotonin, or maybe she's not making enough GABA. What exactly are those metabolites as she's moving her foods down the GI pathways? So again, tools in the tool belt to really help understand and provide answers for that lovely individual in front of you. And Dr. Pam Smith, along with Devaki Berkson, both of these physicians have been key in providing excellent information, a wide variety of seminar, a lot of conferences, and they've just been very kind to share, very gracious with their information. And I really hope that you check out these books, because for me, these are 3 of the most helpful books. I recommend these to patients all the time. They're very easy to read. They're very easy to understand. And she even has more books on immunity and, maximize your immunity, as well as what you must understand about male hormones. There's a wide variety of books that are out there that are great for patients to understand so that they can fully invest in taking part in their health pathway. But I also wanted to bring everybody's attention to, we do have some risks at stake here. The FDA is trying to limit and or take away our rights and access to compounded medications, to individualized medications. This isn't new. However, the FDA is making more mention of this now. And so you can go to compounding.com. There's a wide variety of areas where you can submit patient testimonial, provider testimonial. You can always contact your congressperson. You can contact your senators as well and let them know why it's important that the FDA stay in their lane, because the Congress has set forth boundaries and the FDA is ever stepping those boundaries once again. So, and of course, if there's anything that I can do to help support that, there are some House represented bills as well as some Senate companion bills that are available. We're really hoping that everyone will, that's in a lawmaking chair, is able to sign off on those so that we can ensure our access to compounded medications and individualized medication therapy. This is how you can contact me if you have any questions. I ask that you get a hold of me any way you can do that. You can reach me at mmoser@revcustomrx.com. This is my personal cell. You can also find me on social media. I'm on Facebook, I'm on Instagram, and also on LinkedIn. I'm also the LDN pharmacist. I am an LDN master specialist, and I'm more than happy to help in any way that I possibly can. And here's our network of pharmacies that we have at the Revelation Pharma family. And of course, there are a wide variety of clinical liaisons that would be happy to help you in your navigation of personal health. Thank you again for inviting me into your home and that you've been here to share this with us today. I think this is absolutely wonderful, and I really look forward to hearing from everybody again. If you have any questions, give me a buzz. I'd be happy to connect with you. I'll go back to my personal pieces here. Thanks so very much. You take care, and we'll talk again soon.